So today I want to discuss a common drill I've seen on social media in YouTube to address hip impingement, or femoral acetabular impingement, abbreviated as FAI. Now the goal of this drill is to improve hip capsule joint mobility and improve hip flexion and internal rotation. Now FAI is often associated with a loss of internal rotation and hip flexion, and the symptoms are often bothersome with hip flexion and internal rotation. So yes, we want to improve these ranges of motion and tests and measures that help us diagnose hip impingement. But if we have a sensitive joint capsule, then just moving through these ranges of motion may aggravate the symptoms. So the drill I'm talking about is if we get a heavy band, put it around the hip, get some tension on it, and then move that femur through internal rotation and external rotation in the hopes of improving these ranges of motion at the hip. Now, the problem with this, and to be honest, this doesn't even feel good on my own hip because I struggle with FAI as well. The problem with this is we're already maxing out the femur in end range flexion and internal rotation from a femur on pelvis perspective, which is oftentimes already going to be the aggravating factor, and it's just going to make your condition worse. So if we max out the position from the start, then we have no range of motion to move into. Now, this goes without saying the issues with band distraction drills in general. What we know about them in the research is they're probably not doing what we think they're doing. They're not excessively stretching the joint capsule. When it comes to stretching connective tissue and ligaments around the hip, we have to understand that the small joint rotator muscles insert and kind of become that capsule. They kind of blend into it. So it's all about finding the right leverages to stretch those muscles, which will influence how the capsule moves. So just the fact that we're applying a band around, proximally at the joint doesn't mean we're stretching the joint capsule any different than if we were doing this without the band. Okay, this feels kind of the same when I do this. Now the band does have some neurophysiological benefits. When the band is wrapped tight around the hip joint, it can have some desensitization effects, meaning it can help reduce pain. Just the fact that there is a lot of tight pressure around the hip and kind of choking out some of the pain receptor nerves. But that's not addressing the root of the problem and influencing the range of motion in ways we want. So I'm going to show you two other drills that are going to be much more effective than this one to improve that hip flexion and internal rotation at the hip. So the first drill is going to be a half kneeling internal rotation drill. Now, I prefer to start working on internal rotation from more of a pelvis moving on top of the femur perspective compared to the femur moving on top of the pelvis, because that femur moving on top of the pelvis tends to be the most aggravating type of internal rotation. So in this context, I'm going to have my back foot supported and stationary on a heavy kettlebell, any type of heavy object, squat rack, pole, door frame, it all works. So I'm going to get into a half kneeling position. Now from here, I don't want to think about squeezing my glutes and pushing the hip forward. We're not treating this like a hip flexor stretch. We want to keep a little bit of pike in the hip here, just a little bit of hip flexion so we can get some length to the glutes back here, the tissues that create external rotation, like the posterior fibers of the glute median min, glute max, and then also just some of the hip rotator muscles. So from here, I'm moving the pelvis over top of a fixed femur, okay? So in this position, and one, I'm not maxed out into hip flexion, so I'm not approaching any of those aggravating joint structures. Now here I feel a really strong twisting stretch through internal rotation that I can actually apply some good force into. I'm pushing my foot into the heavy object. So I'm building some capacity through these hip rotators. Now I can hold that for maybe 10 to 20 seconds, relax, move a little bit deeper in the stretch, rotate my pelvis and torso over top of this fixed femur. Or I can apply some more dynamic repetitions here where I'm simply just moving back and forth, trying to pull myself into the position and then pushing myself out of it and not just twisting at the torso. Okay, notice that my hip is coming a little bit inward as I rotate back. This is taking us into a little bit more internal rotation, or you can keep this very strict and just think about turning at the pelvis and not abducting at all. So that's the first drill. We're setting this up with the femur pre-positioned in hip extension. Now the next drill, I'm going to show you how to improve hip internal rotation with a more hip flexion bias. This next drill is a floor dynamic posterior capsule mobilization. Now, why this one is much better than the first drill I showed is because now we're mobilizing hip internal rotation and flexion with the limbs on the ground and the pelvis moving over top of the femur once again. And instead of using the band as kind of a passive traction force, we're actually using the band as resistance and a way to create some leverage to pull us into deeper range of hip flexion, as well as resist it coming out when we perform the dynamic repetitions. So let me demonstrate. So I'm going to get some good tension in the band. Now from here, I'm going to just rotate my foot in slightly into some external rotation. And this just allows the femur to stay in the sagittal plane so the pelvis isn't hiking as I move back into hip flexion. If I just kept the foot directly in line with the knee and I move back into hip flexion, if I'm limited in this direction, naturally my pelvis and low back is going to hike when I run out of that range of motion. So what I could do is externally rotate. This will drop that pelvis on this side and get much more length into the lateral hip tissues here. Okay, so I'm setting up with the knee just under the hip to start. Okay, I'm not maxing out my hip flexion here. Now from here, I'm going to anteriorly tilt the pelvis. So I'm creating that arch in my back, allowing the band to pull me back toward the pole, toward the anchor point. And I should already feel some good lengthening through the glute here. And now I'm going to thrust the hip forward into a posterior pelvic tilt, driving my knee down and back into the ground, and then allow the hip to move back again. And I'm just doing these repetitions here dynamically. And we should feel no pinch in the hip, making sure we're getting a nice clean anterior pelvic tilt, keeping the pelvis stable. So if I show you from the front view without the band, I'm going to start with that knee directly under the hip, slight external rotation. Now we want to make sure this pelvic bone is either directly in line or slightly dropped. And dropping of this side helps rotate my belly button so it's tracking over the knee. So I'm going to sit back into hip flexion, think about rotating that belly button even more as I sit back, and then push away. And as I come out of it and posteriorly tilt, I'm trying to turn my belly button away this direction, which is a relative external rotation of the femur. So I move through internal rotation and external rotation, getting that full stretch and shorten cycle of those lateral hip gluteal tissues. So I'm just moving back and forth, dropping this pelvis and hiking it. Test, retest. Hip flexion feels much better, and internal rotation feels much less pinchy and blocked. So both of these drills are working on restoring hip internal rotation and flexion, but we're biasing different tissues. Remember, there's multiple different tissues that create external rotation or internal rotation depending on the orientation of the femur, whether it's in extension or flexion. So this drill right here with the band is improving the lengthening capacity of the lateral hip tissues here, the fibers of the glute, med, and min. And the half kneeling internal rotation is going more directly at that joint capsule and hip rotators specifically, but doing so in a way that isn't exacerbating the aggravated tissues. So try these drills out just a couple times a week for maybe 2 to 3 sets, 10 to 20 repetitions, or 60 seconds time under tension, maybe 10 to 20 second contract relax cycles, and your hips will be feeling much better. So please give this a try. Let me know if you have any questions in the comments, and if you want some hip rotational drills like this to improve the way that your squat feels and your hips feel in general, check out my 4-week Supple Hips mobility program. The link is in the description, and check out my website. If you want a more structured program, then you can apply for one-on-one coaching with me. Peace.